Hi, I'm Dr. Marc Schneider. Welcome to my office. I'm an orthopedic surgeon with the Christ Hospital. We want you to have the most enjoyable and best experience with us as possible. If you have any questions, please don't hesitate to ask. We're always looking for ways to improve your experience in the office. A total shoulder replacement is done specifically for pretty advanced arthritis of the shoulder. So most of the time when you come in to see us as orthopedic surgeons, we can treat shoulder arthritis with things like injections, anti-inflammatories, physical therapy, or activity modifications. But if your arthritis advances to bone-on-bone changes where you've lost the cushion in the joint, which is what arthritis is, then this may require a total shoulder replacement. Now there's a standard total shoulder replacement that's done purely for osteoarthritis or rheumatoid arthritis, but there's also something that we do called a reverse total shoulder replacement. And the indication for that is either advanced rotator cuff disease where you have what is known as pseudoparalysis. You can't even lift the arm away from the body because there's such advanced disease of the rotator cuff, or you have arthritis in conjunction with rotator cuff disease, then a reverse shoulder may be indicated. There are also some cases where we'll do a partial shoulder replacement or a resurfacing of the ball of the joint. This is mostly done for avascular necrosis or one-sided shoulder arthritis. A shoulder replacement is done through an incision on the front of the shoulder. So we make an incision about this long on the front part of the shoulder and basically are able to separate the muscles. We don't have to dissect through the muscles themselves. This allows us access to the ball and socket joint, which is what's affected with shoulder arthritis. You've lost the cushion on the joint. Oftentimes there'll be debris or loose bodies or bone spurs, so we're able to clean and smooth up the joint surfaces and basically cut out the arthritis. And then we resurface or replace the shoulder with metal and plastic. So these smooth, shiny, polished surfaces rather than these arthritic potholed surfaces are what we're really doing with a shoulder replacement. There is a risk of complications with any surgical procedure, but the risks with total shoulder replacement are relatively low. There's a slight chance of infection, probably less than 1%. We give you antibiotics during surgery to help minimize that risk. We use special soap and preparation on the skin. We superglue the incision. These are all things that we do to try to minimize the risk of infection. There's also a risk of stiffness in the shoulder that can occur with a shoulder replacement. The biggest risk for how much flexibility you gain or regain after surgery is how stiff it is before surgery. So we do everything we can to try to maximize your range of motion by doing a course of physical therapy and get you moving almost immediately after a shoulder replacement surgery. There's always a slight risk of nerve or a vascular artery or vein injuries, so we take every precaution we can to avoid that. When the nerves do get injured, most of the time that's more of a bruising type injury that resolves over time. At the Christ Hospital, we work in conjunction with our anesthesia team and our pain management team to get you the most optimal pain relief after surgery. This can be a variety of medications and or nerve blocks that can be very beneficial in terms of reducing the pain after a shoulder procedure. The benefit of using a pain block for total shoulder surgery is to improve your pain so that you're able to tolerate and start physical therapy right away. It's very crucial to get the shoulder moving as quickly as possible to try to reduce stiffness and to provide you with the best possible outcome. Typically after a total shoulder replacement, you'll go home either the next day after surgery or the following day. A total shoulder replacement lasts on average 15 to 20 years, sometimes longer, sometimes shorter. Some of it depends on how well you take care of it. Some of it depends on factors that we don't really know, but most of them do last about 15 to 20 years.